Hello, my name is Dr. Alexandra Dubinska, and I'm a urogynecologist and women's health specialist. I help women to live their best life by improving the pelvic, sexual, and hormonal health. This month, we have been talking about overreactive bladder, condition associated with urinary urgency, frequency, nighttime voids, and uncontrollable loss of urine associated with the urge to go. So let's talk about what can be done to improve the overactive bladder symptoms. First, you can start with behavior modifications, such as decreasing the amount of fluid you drink, changing the type of fluid you drink, doing pelvic floor muscle exercise, or bladder training. But what if all these methods didn't work or didn't work enough? The next step is to try medications. So let's talk about medications for overreactive bladder. There are two main classes of medications, antimuscarinics and beta-3 agonists. These two classes work a little bit differently, but produce the same effect on bladder muscles. They relax the bladder muscles, and by doing that, they improve the symptoms of overreactive bladder. The main difference between these two classes are side effect profile and insurance coverage. Antimuscarinics, such as ditropin, Vesicare, trospium, have been in the market for many years. They usually very well covered. But the downside is that 20% of people who take antimuscarinic will develop dry mouth, dry eyes, and constipation. There is also an emerging data on the risk of dementia by taking these medications. The beta-3 agonists include the medications such as Mibetrix and Gymtesa. They not are really well covered and not that affordable. However, the side effect is not that common, and Mibetrix can cause very rare increase in blood pressure, headache, or runny nose. Gymtesa doesn't have a known side effects. Next option is great for those women who don't want to take medication every single day. So this option is Botox. Yes, you heard me correctly. The same Botox that helps relaxes the wrinkles on your face can help relaxes the muscles in your bladder and treat the symptoms of overreactive bladder. That's a local treatment, so you don't get a systemic absorption of Botox. And usually women get that procedure 2 to 3 times a year. The procedure is done in the office and takes about 2 minutes to perform, very well tolerated. The side effect is sometimes Botox can work too well, and you might feel like it's a little difficult to empty your bladder, but it will wear off. And next time when you see your doctor, just make sure that you tell him or her that you had that difficulty voiding, so you guys might adjust the dose for your next injection. The next option is Neuro modulation, basically retraining the nerves innervating the bladder. And it can be done by 2 different ways. Peripheral tibial nerve stimulation, or PTNS for short, and sacral neuromodulation. PTNS is basically acupuncture on steroids. We take a small acupuncture needle and we insert it in the area of your ankle where the peripheral branches of the nerves innervating the bladder pass through. We attach a current and we stimulate those nerves. Usually you get one session that lasts 30 minutes once a week for 12 weeks. And if you notice improvement, then the goal is to spread out the session to a 1 session per month. Another option is the sacral neuromodulation, is basically the central stimulation of sacral nerves, like a bladder pacemaker. That's usually done in 2 stages. First stage is a trial to make sure that that will help your symptoms. You get a temporary virus placed either in operating room or in the office, and for a week after, you record the symptoms. If you notice at least 50% improvement in your bladder symptoms, it's a good indicator that the permanent implant will work. So the second stage is to place a permanent device. It's usually done in operating room, takes about half an hour to an hour to perform, and you have a very small, about 2 to 3 inches long incision on your buttock area. That's pretty good options to control overactive bladder. So now when you know them, do not delay, don't postpone your visit with your gynecologist. By improving your overreactive bladder symptoms, you will significantly improve the quality of your life. I'll see you soon.